check, mic check.
All right.
See, this is life.
This is damn okay. That's good. That's
Stressful, yeah, to help you
Yeah.
out. Pauline, I don't even know your last name.
De Valensart.
Say it again. I'm sorry.
De Valensart.
I can't even pronounce that.
It's okay.
So, Pauline, you're French or you're Canadian?
Belgian.
Oh, you're Belgian.
Yeah.
See, I'm way off. This is the worst interview ever, guys, just simply because literally Paulina just walked into the office. We're having a conversation. She was asking me about being on the podcast. So I said, hey, let's just go do it now. But Alex warned her about my impulsivity and spontaneity. So here we are.
Thank God you did.
Yeah. So if you want, just make sure it's a little bit close to you.
Okay.
And that way you could hear clearly.
All right. Cool.
I know it's a little bit weird at first. Don't worry.
It's fine. I can get used to this.
Yeah, you'll get used to it. Don't worry. So I know that we were just talking in the other room, and I guess some of the things that are important to you is just using nutrition as a way or method. Well, number one, simplifying how we view nutrition. And then the second part, which I found very interesting, was talking about women's hormones and using nutrition as well to help just regulate, I guess.
Yeah.
So I guess tell me a little bit about your background first, so that the listeners get to know who you are and what you do, and then and we'll just take it from there.
Okay. So born and raised in Belgium. I have a very weird background when it comes to my academic background. I studied biology first, realized that I did not want to work in a lab or be a teacher. So I was like, this isn't going to work. So I went into business because I figured you can do whatever you want with business at the end of the day. It opens a lot of doors. And then after that, I did a master in communications. And all along, I was always very into fitness, not nutrition, not health in general. I started being active when I was a kid. I did horse riding for a while, up until I was 20. Then I did fitness, just regular gym, fitness classes. And then I got into CrossFit. And then when I was 25, so I was doing CrossFit religiously from like 20 to 25. And at 25, I moved here. I continued CrossFit, and I started working for a company doing sales. So nothing in terms of health. And
What were you selling?
promotional products, like things like this.
Oh, okay, perfect.
I mean, we weren't selling this, but like glasses, T-shirts, and then eventually face masks and things like this. And then when I first moved to the US, I gained 30 pounds. 20 to 30, I'm not exactly sure of the number, in 2.5 months.
The American way? Was it stress related or was it just a diet here?
Oh, no, that was diet.
Pure diet.
Yeah.
What were you eating? What did you start eating right away when you got to the United States?
Donuts.
Donuts?
Yeah, that was the first one.
Chocolate donuts or powdered donuts? Or
All
just
of it.
all of them? All right.
Yeah, very crappy donuts from Dunkin' Donuts.
Okay.
And I was like, oh my God, they even purple. This is amazing.
Yeah, this is great.
That was crazy. There was always donuts in the office, a lot of pizza, a lot of crap. And but I knew nothing about nutrition. I knew what was good and not good. I had like that basic knowledge, but I was enjoying life. And then apart from when I was going out or in the office, at home, I felt like I was eating okay. Like,
Don't stop talking. I just got paranoid for a second. Let me just make sure.
Yeah.
No, I'm pretty sure I hit the right buttons, but I'm just making sure. All right, we're good.
Okay.
I just got
Okay. No repeating the whole thing.
Yeah. I've had to do that before. I was on a podcast like 2 weeks ago and we were talking for like 10 minutes and then the guy looks down and he's like, oh no. I was like, all right, we got to start over.
Oh, damn it. Well, yeah, I'm glad we didn't have to do that.
Yeah. Sorry about that.
No worries. And then I went back home for my brother's wedding. So 2.5 months after I moved here. And my mom looked at me, and she never says anything negative, right? She never does. And then she was like, oh, you're enjoying the US. And then I was like, so that was my first clue. And then I saw
Wait. She didn't say, hey, you've gained weight. Hey, you're fat. No, she said, hey, you're enjoying the US?
Yes.
And that's where you got the clue?
Yeah.
Because you knew what she meant. What did she look at you up and down?
I knew what she meant. I don't remember exactly how she looked at me and everything. I just remember that moment I was like, oh, I think I gained weight. I didn't have a scale. I didn't know. And some of my friends, they were way more upfront when they saw me. They were like, "Oh yeah, no, you gain a lot of weight." And then when I see pictures now of the wedding, I'm like, "Oh my god, this is like I was chubby."
Okay.
And so I can't, but I was always like, I kept working out. I was becoming strong. Like I was lifting weights that I wasn't able to lift before. So I was happy about that. I was just like, oh, I'm becoming so much stronger. But obviously, when you're heavier, weightlifting becomes not easier, but you lift more.
Mm-hmm.
And I came back, and that's when I kind of started my own like health journey in terms of like, I'm gonna lose weight, but I don't want to diet. So I'm just gonna cut all the donuts that I always eat in the office. I'm not gonna eat that anymore. And then a lot of people told me in the US, you need to pay attention to the quality of the food you eat. Because if you go and buy a chicken at Publix, if it's not organic, chances are it's like loaded with hormones. And in Europe, maybe it's caught up now, but like in Europe at that time, you didn't really have to worry about the quality of the food. And everything was so much smaller too, like all the portions so much smaller. So here, I started being careful, and I started to get into podcasts. Actually, I was listening to a lot of people when it came to nutrition, and I was just applying what they were saying. And then I lost the weight very gradually, but I kept it off. And every time I was coming back to Belgium, everybody was like, "Oh, you lost weight. Oh, you lost weight." And I wasn't really weighing myself, so I didn't know, but I could see it in my clothes and everything. And then one day I remember my coworker, she was asking me some health advice because with all the podcasts that I was listening to, I started becoming a little knowledgeable. And she was like, "Pauline, you should really study this and you should do something with this, because every time someone has a question about health in the office, you always go on that like huge tangent and you tell us like why and how and why this is like this and what we should do." And then I was like, why not actually, why not doing that? And I also knew that college in the States, like, it's so expensive. And so I didn't want to go back to college because I didn't have any money. I was an intern selling sunglasses. And so I looked into certifications, and I came across a health coaching certification. And I had no idea what health coaching was. Reviews of that school were good. It was it was towards nutrition. And so I was like, oh, I'm just going to do that. I didn't know what a health coach was. I didn't know the difference between a health coach and a nutritionist. In my head, I was going to become a nutritionist, but you got to go back to college for that. And so I did that certification, and then it opened my eyes on many, many things. And I continued I never gained that weight back because I made so many changes on my own lifestyle that I was becoming the healthier version of myself. And so I wanted to help people get there too, because it's not that hard. It just requires boring work.
So how do you convince somebody who wants, because usually when somebody comes to you for weight loss, because you said you lost the weight gradually over a long period of time. And then that became sustainable. You were able to keep it off.
Yeah.
And you were probably also working out at the same time.
Yeah, I was. I never stopped working out.
The issue that we run into right now, or with many people, is the fact that they want the crash diet. They want to see the weight come off quickly. And what studies tell us about that is that usually they gain that weight back and then more.
Yeah.
Right now, people are going crazy with semaglutide and other peptides that they're using to suppress hunger. The weight loss is incredible.
Yeah.
But if they're not doing the other behavioral changes that should be occurring, like working out, building muscle, high protein diets, lifestyle changes, then once they stop that semaglutide, they're going to see a huge rebound.
Yeah.
So from what you learned, even experimenting on yourself during that time, how can you get people to, and as a nutrition coach, how can you get people, or as a health coach, how can you get people to have sustainable weight loss and allow them to understand that this is going to be gradual, boring work? There's no ta-da moment, right? It's just slow, boring, methodical, consistent. It requires discipline. How do we do that?
It's tough. I won't lie, it's tough because, I mean, it really depends. I think that it depends on the mindset of the person when they come to see me. And I kind of know, like when someone just ask a question like, how can I lose weight? And, you can kind of pick how much of a priority that is for them. If it's just like they want a weight loss in like a month and not something sustainable, maybe they're not ready. And I like to, when I meet someone for the first time, or let's say I have a potential client that I have on the phone, I let them know I always ask them how much of a priority that is for them. And if it's anything less than a 7, it's going to be tough. And I let them know why. Because it needs to be, the reason why they want to lose weight has to be very, very strong so that they're going to be able to use that whenever it gets tough and whenever they need to do the work. Because otherwise, they just won't do it. And they're probably going to do like that quick detox that they saw on Instagram, or, you know, semaglutide or things like this. But something that I like to do, just so that they kind of understand, is I make money analogies. And I feel like people really understand that. So the way I ask them to look at weight loss is to reframe weight loss in terms of reframing weight loss into health. I want to be healthy, so that weight loss is going to be a byproduct of it. And then I tell them, like, and health is like those savings bank account. It takes years. And you're going to build that and build that and build that. And you build that through habits. You know, good financial habits, good investments, smart investments. And then once you have a substantial amount in this account, you can, of course, allow yourself like the occasional binge on the weekend or something like that, because you're going to pay that off right away. Because you know that your habits and your lifestyle is 80% of your life. And so when you make that money analogy, they understand, like, yeah, it's true that if I want to save money, I can save quickly for a trip and then be broke after. Or I can be very disciplined, very diligent, not spend on the things that are going to give me like a quick pleasure right now, but like just put that into saving and trust that one day I'm going to need this. And this is going to be very, it's going to come in handy when it needs to come.
How do you help people delay gratification? Because that's what makes us go to the purple donuts. That's what forces us to go to Coca-Cola instead of having water. I mean, it feels good.
Yeah, it does. I think that so when I start working with someone, I never restrict. So at first, it's not for everybody, but for most people, I'm gonna ask them, hey, they're gonna take a picture of their food for a week, so I kind of see what they eat, or tracking, one or the other. But I like the picture because I feel like I see also the quality of the food in a picture way better than just tracking. And then I'm gonna tell them, okay, this week you're just gonna focus on adding vegetables. I want to see your plate 50% green. And so they're like, oh, but I can still eat my snacks. I'm like, I don't care about your snacks. Eat whatever you want. Just add. And then week 2 is going to be add proteins. And then week 3, like whatever. Sometimes it's different clients to clients, right? But it's always about...
So I'm sorry to interrupt you. You're holding them accountable week to week by them sending you pictures?
Yes.
Okay.
I want to see everything they eat.
Is this a program that you use, or you're just texting back and forth?
No, it's an app. I use an app,
okay.
and so they can upload everything in there, and I can see what they post. So it's very convenient. And I post my food too.
Okay, cool.
So they can see it too.
And then you meet with them once a week, or how does that work?
Once a week.
Okay.
Yeah. And then we go over their food. And usually by not restricting, but just adding, the first thing that comes up is like, I'm not that hungry anymore for my snacks. And then also like an important things that I forgot to say is that if their snack is, let's say, a donut, I'm going to tell them at some point, okay, so I want you to add a fruit. You can still have the donut, but you're going to eat the fruit first. So eat your apple or whatever fruit you want.
You're making me hungry. That's why I'm
your grapes.
There you go.
And then eat your donuts. So chances are they won't eat the donuts. And sometimes it's just, okay, you're going to cut the donuts into, you can still have it. And then as we go in, it's going to be replace the donuts with Greek yogurts and berries. Those are examples because, again, like every client is different and everybody requires different things. But I don't like going into it with like restriction because otherwise, like, I cannot have this anymore and that's going to be tough. And usually as we go in through into the weeks, they get less hungry because they eat more. They eat more vegetables. They eat more proteins. And so they're less hungry for their snacks. And even if they were hungry for their snacks, they have alternatives. And so you don't have that frustration of, damn it, I really want something. Can I swear in here?
Oh yeah, of course you can. I swear all the time.
Yeah, okay, good. And so yeah, they don't have that frustration, but still, it's still gonna suck. And so sometimes when I mean not sometimes, all the time when I first have them on the phone for the first conversation, I let them know, and I let them know, look, like I really want to work with you. There is only so much I can do, and I'm gonna give it my best because I want you to get the results you want, but you need to do the work too, and that's not gonna be easy. And that's why I'm here. I'm here so that for those moments where it's gonna suck, where you're gonna want to give up because it's not easy, that's where I really come into play. But I need you. It's teamwork.
Is your main focus weight loss, or do you deal with all sorts of athletes? Like, do most people seek you for weight loss?
I would say 50% weight loss, 50% menstrual cycle problems.
Okay.
I like both. Usually when someone really comes to see me just for weight loss and really just want the weight loss, it's usually when they're seeking that fast transformation. And so usually we end up not working together. So once they understand that weight loss is going to be a byproduct of getting healthier, that's usually when we start working together.
Okay. Yeah, when somebody says, oh, I have a wedding coming up in 2 months and I need to fit into my dress, you're like, I mean, that's not really...
I mean,
you'll help them, but that's not really
exactly. I'm like, I can help you, but then, like, do you want to fit into your dress and then be the healthier version of yourself? Do you want to be healthy after that? Or do you just want to lose 10 pounds for your wedding? Because those are really two different things.
100%. Yeah, so you're just trying to understand the person's goals first before you dive in with them. So I feel like, I mean, we could go on and on about weight loss, but I really want to dive into irregular menstruation and stuff like that, and women's health, because I think that's something that's not commonly talked about.
Yeah.
So I guess I'll let you take the ball on the court and just, I guess, lead the way. Why is this important?
Fertility, even if your end goal isn't to have kids, it's very important because it's a marker of health and longevity. So it's kind of weird because sometimes there's a lot of like, I listen to a lot of podcasts where how to improve and really work on your fertility. And the comments that I see in this podcast are, what if I don't want kids? But you should still care about your fertility because it's directly correlated with your health.
How so?
Well, if you're really healthy, you're going to have a regular menstrual cycle as a woman. And as a man, you're going to have healthy sperm count, healthy testosterone, all of that. And so testosterone is very important for men and for women.
So I'll just put it out there since, I've had a really stressful year from January to now. We're June 19th. What's today's date?
21st?
22nd. Wow,
22nd.
Look at that. This is June 22nd. And I was feeling down, like almost symptoms of depression, but I wasn't really depressed. I was like, well, everything's going well in my life. So biologically, what's going on? So I went and had lab work done. And sure enough, my testosterone came back at like 3 something.
Yeah.
So I was like, oh, wow. I'm male. I'm 39. I've always been physically active. I consider myself healthy, but then all of a sudden I'm finding my T is low.
Yeah.
So now how would you guide me? Would you go right away to supplementing testosterone, or would you try nutritional changes and behavioral adaptations? Like, what would be the route you would take?
Yeah. So I would say I'm absolutely not against TRT, but I would say definitely get the lifestyle in check first. And then if that didn't work, then TRT, because testosterone is so important. You're going to lose all your drive, your motivation and everything if you don't have it. But there's a lot of stuff that you can do in terms of lifestyle to improve your testosterone. And the first 2 big ones are exercise and sleep. Those are the 2 that are really going to help move the needle. Good nutrition, of course, but I don't want to put an order on,
that's okay.
But nutrition as well. And also something that's kind of, everybody says it out there, and it's kind of like getting lost a little bit into the weeds, but it's sunlight exposure or light exposure, just that, because it really helps with dopamine level, with down the line, helps with testosterone levels. Everything is interconnected. And so if you do all these things really well, chances are your testosterone is going to bounce back up.
Yeah.
But also there's that reality of like after, don't exactly remember the numbers.
Yeah, in your
but
early 30s, you already start to
it
decline.
declines.
And the problem that I had that I would tell to younger listeners is that I didn't have a baseline. So
Yeah.
I had my PCP prior to this, because I asked for it,
Mm-hmm.
hadn't checked my testosterone levels. And I think that's a failure on the part of the healthcare system as a whole, that,
Yeah.
hey, even into a male's, let's say, late 20s, let's just get a marker. Let's just see where is your testosterone level.
Mm-hmm.
So that way, when you're 32, you say, oh, it's still good. 34, or it's still, 35. All of a sudden, you start seeing a dip.
Yeah.
All right, let's monitor this a little bit closer.
Mm-hmm.
Is there any environmental factors that are probably influencing it? Can I improve my nutrition? Can I work out more? Is my sleep okay?
Yeah.
Are my cortisol levels through the roof because you're stressed out, because
Yeah.
you're trying to run a business and you don't know what the hell you're doing? Hi, it's me. So, yeah, I think it's really important that, number one, that we speak openly about it, because
Yeah.
I think some men find a lot of pride and bravado of
Extremely,
right.
yes.
Oh, my testosterone's high,
It's an ego thing.
and I'm
for
like,
most
look,
men.
honestly, I mean, yeah, your gonads are producing testosterone, great, but just because it decline doesn't make you less of a man. In
Yeah,
fact, I'm
yeah.
just as strong as I was. I didn't
Yeah.
see loss of muscle. My sex drive was the same, but I was feeling a fog, a lack of clarity, a lack of motivation. But I was just muscling. I was David Goggins I was just muscling my way through it. But it doesn't have to be that way.
It doesn't have to be that way. And to your point, like when I don't have a lot of male clients because, yeah, and I didn't say this, but I'm also a personal trainer. And at the gym, when I have a male client, I find it, especially if they're older, I don't know how they're going to take, hey, maybe you should check your testosterone. Because I don't know if I'm overstepping into like a male ego thing.
But I think you shouldn't even feel that way, because you're being objective. This
Yeah.
is an objective and measurable lab, right? And so in psychiatry, when you're interviewing a patient, man, you're diving into their personal life. Have they been sexually abused, physically abused? Is there domestic violence? How are their finances? I think people have to understand that even as a trainer, as a nutritionist, it does feel intrusive, but
You need to go there.
you need to go there.
Yeah.
You have to go there, because if not, then you're not helping the patient the most that you, or
Yeah.
the person the most that you can.
Yeah, yeah. No,
Sorry, I took
absolutely.
you on a tangent there.
No, totally fine. And then, but for women, testosterone is so important too, because actually, and that's something that people don't realize, that even though we have way less testosterone than men, this is the most prevalent sex hormone, more than estrogen, more than progesterone. And so it's extremely important. And when a woman starts, like when the testosterone in a woman starts declining, it's the same effect as the man.
Decrease sexual libido,
Yeah.
decrease motivation, decrease energy. Yeah.
energy, all of this. And the problem is then it spirals into, like all these other, like once one thing kind of like falls apart, then the other things tend to fall apart too. And testosterone is so important for motivation, for energy, for everything good in life also, that it makes it so easy to just like not do anything anymore. And but that's more for women, I would say. I mean, it's also very possible for for younger women, but that's more a problem around like perimenopause, which is like, can start anywhere from like 35 to 50 up until menopause. But
I'm curious to know, like when you go to your primary care, do they check a woman's testosterone levels? And it's probably no.
No. So I'm kind of guilty of this too.
Yeah.
I used to do blood work kind of regularly in Belgium, but it was very basic. So just like complete blood count and a few other things. I measured my testosterone for the first time here in the States. So that would be actually cool to see, like, it was last year. So it would be actually cool to see, okay, I had baseline at 33, now I'm 34. That would be actually cool to see like over the years. But especially for a woman in her perimenopause year, testosterone is declining, as well as estrogen, as well as progesterone. So it's kind of like a very hard roller coaster for a woman during those years up until menopause. And I feel like society is in delivering good service to these women. And I see that at the gym too, like when a client comes in, to me, if it's a woman in her 40s, we should pay attention to that, that should be talked about, and the plan of care, like the training plan and nutrition plan should be according to that. And we should have also conversation about maybe it's time also to test your testosterone and your hormone levels in general, because maybe you're in perimenopause and you think you're just going crazy because you can get extremely anxious, and when when progesterone also goes down, like you get especially a little bit more anxious. You have symptoms of estrogen dominance, which are not very very cool to have. But if no one addresses that, they just think, what the hell is going on with me? And then I cannot lose weight, and I'm doing this gym thing, and I work out 3 times a week, and I do cardio, which is the worst thing that a woman in perimenopause or menopause can do. And they not seeing any results, and they can't handle cortisol as well as they did when they were younger. So, but I mean, that's not really like Mario focus with women actually, but I just
No, but
I
it's
guess
still good, because I think what you said, I wrote it down, is that lab work during an initial meeting as a personal trainer is probably crucial in some instances, and I don't think it's a common practice.
It's not. I also think that, so I have 2 opinions about lab work. I think that there is a lot of things that you can do before spending, because those lab work, of course, are expensive. So I think that there is a lot of things you can do before that. You can really address all those lifestyle changes. If they have a crappy lifestyle, that's kind of like an easy fix.
Mm-hmm. But again, if you don't have a baseline so that you know where you're at before you make those
Yeah.
lifestyle changes, then it's a little bit, it's motivating. Like
It's
it
is.
right away, when I saw
have
testosterone was
data.
low, what am I doing?
Yeah.
With the data, now I can say, okay, what's the plan to,
Mm-hmm.
and even, or maybe you see lab work and you say, wow, that's low. Thankfully, I'm not having the symptoms, but I could still make improvements so that
Yeah.
I don't reach that critical low where I am starting to have,
Yeah.
you know, symptoms that are detrimental to me and to my well-being, to my quality of life.
Yeah. And yeah, no, but to your point, I think it would be actually a very good add-on to have like lab work right away, so that they can also see and retest 3 or 6 months after and see how that has improved.
Yeah, for sure.
Yeah.
Just same way that they take before and after photos, right?
Yeah.
Which are great. I prefer a before and after photo over the scale, because the scale often
100%.
lies.
Yeah.
Women often are just so fixated on the
Yes.
weight loss and the weight loss and the weight loss. But the truth is, how are your clothes fitting you? How do you look in the mirror? How do you
Yes.
feel in a bikini? You know, do you see the difference in muscle tone just visually?
Yeah. The scale is so prominent still in our culture. And for women, I think that it's harder for women, because there's that stigma of, and I feel like it's still very present, like you need to be skinny, you know? Hopefully I think it's changing. I hope so. Maybe I'm too close to it to see it. But yeah, like that being skinny is still kind of like the golden, what's the expression?
The golden rule?
Yeah,
Okay.
yeah, I guess for women to be attractive or to be like, you know, within society, to fit within society. Hopefully that's changing.
I think we're definitely shifting. I think there's.
I hope so.
Because I could see it if you think about social media and a lot of people who have a ton of followers. There's a lot more fitness influencers, a lot more women who are more muscular. So I think there's a definite shift, but I think the mentality of the scale still scares.
Yeah.
Still is. There's some fear involved there. Oh my
Yeah.
God, I'm 130 pounds. So what? What does your body composition look
Yeah.
like? Right? If you're dense in muscle, then good for you.
Yeah.
130, you're so
Yeah, yeah.
you're 5'4", you're 130, and your legs are built like a mule. That's amazing. You
Yeah.
squat, 225 for reps. Good for you.
Yeah, yeah.
You don't, at that point, you
You shouldn't care about the scale. Yeah, you shouldn't care about the scale. And hopefully, like, I hope you're right that it is shifting.
So sorry, we steered away a little bit from the women's hormones. So you mentioned about fertility being a marker of health and longevity. So what is it that women should be looking for in terms of fertility or hormone stability? Like,
So I think that there is so many hormone disruptors in our environment, starting with like just consumption of plastic, not consumption of plastic, but like use of plastic that disturbs hormones. A lot of things that we put on our skins, fragrances, and beauty products, like they disturbs hormones a lot. And so I think that there is, not a thing, but like there is a lot of women in their teenage years that already have menstrual problems. And the problem with that is like they would go to the OB and the answer to like irregular period or very bad PMS and bad cramps or acne, it would be go on the pill. That will regulate your period. Go on the pill. You will get rid of the acne. Go on the pill, XYZ. But the problem is you put a Band-Aid on a problem that is there that needs to be addressed and that could be changed with lifestyle changes. Absolutely. Nutrition, exposure to toxin is one of the biggest one when it comes to like hormone disruptors. They call endocrine disruptors. But they're not like, we don't say that. So these girls go on the pill with all the side effects that the pill has, and they're not told that the pill actually have side effects. So they could get depressed. They don't know why. But anyway, that's another debate.
No, they can have clotting issues. They can
They
have a
can-
pulmonary embolism.
Absolutely.
There's all
They
sorts of
have-
risks that are involved with birth control.
So many. And they're not aware of those risks. And the data apparently, like there were some studies in Denmark and they found out that 52% of women that are on the pill is not for contraception. And out of those 52% that are on the pill for reasons that are other from of contraception, they don't know the side effects of the pill. It's not like the doctor sat them down and was like, okay, I'm going to give you a pill that's probably going to make you depressed. That's, if you're into sports, you're not going to be as strong as you could. And then all the list of side effects, blood clots, all of this. And if they knew, they would probably say, I'm not sure I want to take this, you know? But the real problem is, like, let's say they have irregular periods.
Wait, you said 52% of women take the pill for other reasons besides contraception. What are some of those reasons?
So irregularity in the cycle, very heavy PMS, cramps, acne, those would be the main ones. And the problem also is, so when you're a teenager, the brain and the ovaries are starting this whole communication that the pill is going to interrupt. But this is a normal thing that has to happen when you're a teenager, when you first start to get your period and everything. But the pill interrupted that is pretty, what's the word I'm looking for? Like a very negative thing to happen, because once they get off the pill in their 20s or 30s or whenever they want to have a baby, that communication has never been really well established, first of all. And on top of it, let's say it was irregular for another reason. Let's say PCOS is one of the most popular one. You put a Band-Aid on that. You still have PCOS in your 30s. And you can address that. And so, you know, like they told, you won't be able to have a baby without IVF or things like this. This is scary. And no one talks about this. And no one also talks about the fact that PCOS is also it's rooted into insulin resistance. So diet has a huge component to it. You can actually address your PCOS with a really good diet, with a lot of lifestyle things like stress management, good sleep, all of this. There's many cases of PCOS reversal just by the lifestyle. But if you've never done that, you don't know. And no one tells you.
Yeah. So you feel like there's just a lack of education.
Yeah.
Because people are they're given these pills. Women are given these pills at a young age to treat acne, to treat different issues that are arising. And then down the road, they want to have a child, and then they're unable to, because now the fertility issue has occurred already, where there's not this communication between the brain and the ovaries. And now they find themselves going to very costly in vitro treatments that sometimes aren't even effective.
Yeah. And so I think that it is like there is so many more conversations to be had with doctors around the pill prescription. And even if, let's say, your goal is 100% contraception, you should still be aware of the side effect of the pill. Anybody should be, like, for any pill, for that matter.
The more that I think about it, I truly believe the healthcare system is broken. And physicians have a 10 to 15 minute window.
Yeah.
You know, whether you're a primary care provider, an MD, a nurse practitioner, a PA, you have 10 to 15 minutes to see this patient, maybe 20 if it's an initial eval in a primary care setting. And we don't have the time to educate these people. And you might know all those things, but then the pill is such an easy thing to write the script and hand it over document what was prescribed. That's what you're reimbursed for in the system.
And then also a thing that in the US, I mean, in Europe too, to an extent, because they're also going to prescribe the pill. But I think that in the US, you are incentivized so much by, I don't know, insurance company, big pharma, and all of that to push a lot of medications on people.
Well, because you have to, in order for me to bill insurance, I have to show diagnostic criteria. There has to be a diagnosis present. And then on top of that, the complexity of the case is what increases the amount that I am reimbursed. So prescribing a medication, that increases the complexity.
Gotcha.
Everything that's involved in that plan. There is not a referral for nutrition that I get that makes it a higher complexity. Not only that, the insurance industry doesn't cover nutritional counseling.
Yeah.
Or if they do, it's minimal. So there's not very many nutritionists that are registered dietitians that how many registered dietitians offices do you see lined up down the street?
Yeah,
Zero.
not many.
Zero. They're all taking money out of pocket.
Yeah.
Maybe if you want to go, you have to have funds to pay for it. So that means the people who need the services the most,
They won't be able to afford it.
they're not going to be able to access it.
And you know, sometimes I think, because as a health coach, one of my dream job would be to work with a doctor. And because you said it, they don't have time. So if let's say an OB says, okay, this is the pill, but actually before we go there, I have a health coach and let's do 3 months with that person first to address everything lifestyle we can address. And then, you know, if that doesn't work, then we'll see. We'll cross that bridge when we get there. And I feel like if doctors were actually working with health coaches, whether it's like for women's health or for type 2 diabetes, or, you know, like there's so many chronic diseases that could be avoided.
So now the question is, from a business perspective, since you're an MBA and you said you studied business first, how do you charge for that? How do you bill for it? Does the person come out of pocket? Are they willing to come out of pocket? Or did they just come to you because they wanted this treatment, this pill, so they can carry on with their lives? Because that's common.
Yeah.
Because we try to go different, more conservative routes with patients, and they're basically like, this is bullshit. I'm going to go to this guy down the street because I know he's going to prescribe it to me. Oh, I don't want to try to do all these behavior modifications. I just want Adderall so I can pass this exam.
Yeah.
So common because we live in a world that's instant gratification. So I'm having this internal struggle as you're talking to me where I'm like, she's right. She's 100% right. But now our society has adopted this mentality where we just want the pill.
Yeah.
We want the easy fix. We want the quick weight loss. We want the remedy that just is like this. But then the truth is, so many things in health, fitness, and wellness are this slow, gradual, boring work, like you described earlier, that I'm afraid that people don't really want to do it.
No, you're totally right. I think that...
Fuck.
No, it's tough. I don't know the answer. I have no idea. I wish I did. Like, I think that there is also two problems. I think not even from a business perspective, but if let's say like the US were to do that, it wouldn't work because that's preventative. And so a lot of drugs wouldn't be sold. So that's the first problem. And then even if that was overcome, then there's a second problem of people want everything yesterday.
That's the bigger problem, I think. Because even if you look at the people who can't afford it, like they still want it quick. So then that's where, and I don't want to go against it. And I'm like, damn, she's right. I mean, we need to implement something to at least give that percentage of people the option to say, hey, there is this option. Let's talk to a nutritionist first. Let's see what lifestyle changes you can make. So take an hour of your day, go see her. Let's see if you could implement these things over a 3-month period and then come back, and then we'll go back from there. Maybe people will do it. Maybe I'm just at the point where I'm being a pessimist about this.
I think some people would. I think it depends. Again, it goes back to why would they do it? You know, is the why is big enough? If the why is big enough, then they might. There is a doctor that I follow that I really like, and he talks about
who is he? Sorry,
Dr. Peter Attia.
Attia, okay.
Yeah, he talks a lot about your last decade of your life to look like. And this is powerful because we don't think about this. Like, especially in our 30s, we still have like a lot of time. But when you think about it and you reverse engineer from there, if you have someone that has a brain in front of you, they're gonna be like, yeah, actually, maybe fixing my lifestyle is what I should do. And maybe the pill is the answer too. I'm not saying like, like I think that in some instances you also need medication, of course. It's just overprescribed. It's too easy. And it's like, take that pill, don't change your life. But what they don't tell them is like, you're gonna die early. You're gonna die early.
Not only are you gonna die early, but the later years of your life is gonna be a poor quality of life.
Yeah, it's gonna be horrible.
I've been in nursing homes. I worked in nursing homes before, and it's not fun. Or if you go to an adult ICU and you see people who are their bodies are worn out because they never took care of themselves. And I think obviously I'm in the healthcare field. I was a nurse working I'm still a nurse, but I was working at the bedside as a nurse, as a registered nurse. So it's very different when you're at the bedside and you're seeing that patient deteriorate. You're seeing how many healthcare workers it takes to keep this person alive, when the reality is that they haven't taken care of themselves forever.
Yeah.
So, yeah, I wish more people could see that, and maybe it could give them some sort of awakening, like Scared Straight, where they say, oh, wow, I definitely need to do something because I don't want that to be me down the road. And I still don't know if that'll work.
Yeah, I still don't know if that would work.
Because it's always like, oh, that won't happen to me until it happens to you.
Until it happens. Maybe also education plays a huge role in it. If we knew more about how to eat well, why do you need to study nutrition to know the basics in nutrition? That doesn't make sense to me. Like, those are things that maybe you should learn in school, how to eat. But schools also are a huge problem. Like, what the kids eat at school is like, is diabetes in a package, It's crazy. And no exercise and all of this. So, like, we're not taught this unless you actually go out of your way to, like, do the research. Because back to, like, when I first moved here, I knew the basics of nutrition, or I thought I knew. I didn't know shit. And I put all this weight. And if I didn't have that wake-up call, I don't know, maybe I would have continued and not took care of myself. I mean, I think I would have had a wake-up call at some point, but most people don't. And they're okay with that.
So what did you do? I mean, I know that you switched your diet. Your mom tells you, hey, you're enjoying the United States. I could see you're enjoying life right now. What are things that you did immediately? Like, what changed? Did you avoid the donuts? Did you?
Yeah. So, like, what changed immediately? I avoided the donuts and the processed foods as much as I could. That was the first thing.
As much as you could. That's important to know.
Yeah. I was still indulging sometimes, or I would have half. But I think that, and again, it goes back to everybody's different. I knew what I could do and I knew what I could sustain. When I work with a client, maybe that's not the right approach, because if I do that, then they're going to binge down the line. So again, very important to see who you have in front of you, how they operate, and what they can and cannot do right now. In my case, it was like, no donuts anymore, unless like sometimes. No pizza. We were going to fucking Domino's and things like this. Like, it was terrible, but we were going there a lot. So now if I would like a pizza, I would go to something like Mr. One, for example. That's like better. Like, I'm not saying, hey, you can eat all the pizza that you want.
Yeah, it's better quality, a little bit more protein.
Exactly. Yeah. And then in terms of my diet at home, I switched the meat that I was eating for organic meat, because I was like, I could see that all the meat that I was eating, I'm sure there was like they were so pumped with hormones that I was just like getting so bloated everywhere. I switched that and eating more, like, I don't remember exactly, because again, it was very gradual, but I think I remember eating more vegetables, and just more quality, like paying attention to the quality of the food, drastically reduce sugar. I was eating too much sugar and I didn't know, even at home, like not even counting the donuts and all the processed carbs, the pizza, and it was just eating a lot of sugar at home. So I reduced that. And then as I went through also the nutrition school I did, and as I went through all this, I would always implement little things. Like at that school, they really stressed out the importance of sleep and stress management. And so I started being more aware of those things and be like, okay, actually, I should probably prioritize sleep. Alcohol was a big one too, because I was partying all the time. So luckily I'm a lightweight, so like with one drink, but I would try to pay attention to that, because people don't realize that drinking the calories is just huge. And they're like, oh, I ate perfectly, and then they're getting hammered on the weekend, and they don't realize that that's very detrimental too.
Yeah, and typically when you are hammered or you start having a couple of drinks, then you crave salty foods and you start snacking.
Yeah.
And then on top of that, your sleep is deprived because you don't get the same REM sleep after you're ingesting alcohol. So it's all this cycle that goes along with alcohol in itself that people try to ignore, but it's always there and it's always going to affect you. So if you're overweight and you're trying to lose weight, you better not, just like she talked about the donuts, not necessarily eliminate it, but definitely reduce the consumption of it. Because that's something that people want to overlook because they enjoy it. Again, they get to indulge, but then it's absolutely detrimental to their physical health.
Yeah. So yeah, alcohol was a big one too. And it was very gradual. Everything I was learning at school, I was kind of like applying on myself, and then I kept on losing weight until like I reached my... Talking with weight is a little tough because my body composition changed so much also over the years because I was still working out, and then I worked out way better, so I gained a lot of lean mass. So like my weight now is actually only 10 pounds off the heaviest I was.
Yeah, but how much fat?
Exactly.
Was your
so my
fat
body
percentage back then versus now?
Exactly. So back then it was all fat percentage. It's still a good amount of lean mass because I was lifting regularly, but like all my overweight was fat. Here I'm a healthy weight, but I know that I'm way fitter than I was before.
How much of you being a health coach is just being an educator?
Oh wow, that's like 80%.
It's most
90%,
of it, right?
Yeah.
Because it's just filling deficits in knowledge continuously.
Yeah.
Continuously.
Because when people also, and that's what I do with my clients, I like them to understand why. So if I ask them to do something, I'm going to go into like letting them know why and educate them on the food, educate them on the stress, educate them on the sleep, so that they can understand. It's not just like, hey, yeah, I know I need to get 8 hours of sleep a night, whatever.
Yeah, there's a rationale behind it. And I think that's what people miss out on. It's just that. It's the educational piece. And then the more they know, because what you know definitely influences your behavior. And then at least you can make a better choice. Oh, let me have, today I went to the fridge. I had a protein shake for breakfast. And then I saw the Entenmann's chocolate donuts that were there. And I was like, it looks good, but I don't really need these calories right now. So I just broke off a little piece and then went on my way. Yeah. I'm not eliminating it. It's still there. Yeah. But I know that I'm not going to sit there and ingest. And if I'm not full, then, I mean, if I want to get full, then I need to ingest protein or something else, because eating 4 donuts is going to fill me up for like 30 minutes.
Yeah. And then you're going to crave more.
Yeah, I'm going to crave more. I'm going to have a huge spike, right? In insulin.
Yeah.
And I'm still going
to go down.
My energy's going to go down, and I'm still going to be hungry an hour later. Yeah. Despite all these calories I just ingested. And I think once people start understanding things like some simple little behaviors like that, you say, okay, cool, I'm going to have a little piece of this. But if I really want to get full, this is not going to do the trick. So I need to have something else.
And that's why a lot of people also confuse, the calories that you can have in a day. Of course, if you want to lose weight, you need to be in a calorie deficit. And everybody agrees on that. But what they don't understand is that the type of calorie they're going to eat is either going to work for them or against them. It's going to be extremely miserable to go in a calorie deficit with like a lot of sugar and processed foods, because you're going to be hungry all the time, all the time. And
it sucks to be hungry because I get pissed.
Yeah. Everybody does. Like, you're a terrible person. Yeah. So that's one thing that, and sometimes I see that at the gym, right? So people try their food and I'm like, oh yeah, this is within my calorie count. I'm like, I'm not denying that, but is this working for you or against you? Because were you hungry after that? Probably you were, versus having something that's more protein heavy, you wouldn't be hungry after. And so that helps, because losing weight already sucks. Don't make it suck more.
I agree 100%. Is there something we haven't touched on that you wanted to talk about?
I don't believe so.
No? I know this was super random, but I definitely just wanted to have the chance for you to come on. You're going to be moving to Colorado soon.
That's awesome.
When are you moving to Colorado?
The end of August.
So soon.
Yeah, pretty soon. Yeah.
And you want to do the same thing over there. You're going to be a health coach over there. Awesome.
Health coach over there. Yeah.
And do you already have something lined up for yourself?
You mean in terms
Of work, life, everything?
No.
No? Amazing.
No, but we're looking for a place to live. It's still just a little too early to pull the trigger on anything, but we still have an idea of where we want to be. In terms of work, so my husband will be able to work remotely.
Awesome.
And me, I was in between, like, because I'm also a personal trainer. So my goal is to just do my business over there in terms of like health coaching. I really want this to work, and I think it can. So I think if I put the work that I need to put in, it's going to be okay. I'm working with amazing clients right now. And if it continues like that, I don't see why that wouldn't be sustainable. But, being a personal trainer is also very, very convenient. You can just walk into a gym and like, hey, like I'm a PT.
Here. Yeah.
Give me some work.
Yeah.
So it's scary because also like I've never thought of myself as an entrepreneur. This is the crazy thing. Even though I did business, my dad was an entrepreneur. And I remember in business school, one of my teachers was like, okay, how many people here in the class want to be an entrepreneur? And almost all the hands went up. Mine didn't. I was like, fuck that. No,
it's hard.
I don't want to be like, like I've seen my dad. Like, I don't
Why,
want
what
that
kind of
life.
businesses your dad have?
He used to have, he had many. I don't even remember. He passed away when I was 20.
Oh, I'm sorry.
But thank you. It was a long time ago. But he had multiple companies, software companies. Then he was a little ahead of his time when he founded another one for depolluting engines. But that didn't work out. And then he was a business consultant.
Depolluting engines? What do you mean? Like,
is that an English word? Maybe.
So I guess like engines that don't release carbon monoxide.
Exactly.
Oh, the government shut that shit down. That's what happened.
Like probably. Yeah. It was also like years, and I was like 10 or 11 when he came up with that, and unfortunately that didn't work out. And then he paid the price with his health. So I saw that, and I was like, I don't want that stress. I don't want all of that. And then.
So why? How old was he when he passed away? If you don't mind me asking.
What?
How old was he when he passed?
Oh, hold on. So I was 21. So he must have been 62.
So young, yeah.
Yeah, pretty young. He got diagnosed with cancer at 56, something like that.
Mm-hmm.
And the thing that happened is it was kidney cancer. So he got surgery. And after the surgery, doctors were like, "Oh, you're completely fine. We removed the kidney."
It had metastasized somewhere else.
But yeah, it did. And so, but the thing is, like, it was the best life lesson I could ever gotten from my dad, because the doctors, when they saw that it metastasized, they told him, "You have a month," and he lived 7 years. Because my dad was kind of like, "Okay, so if you're telling me I have a month, I'm gonna find something that I I have nothing to lose here."
Yeah.
And so he got into clinical trials that he found himself. His doctors didn't find that.
Uh-huh.
And it was a whole, he was also in another country, so it was a whole thing. But he made it work. And at the end of the day, that's crazy, because I've always known my dad working like his ass off, nonstop. So I was barely seeing him as a kid. And when he got diagnosed, I was 14. And those 7 years, I wouldn't say those were the best years with him, but pretty much, because he was home.
He was present.
He was present. So, yeah. So, told you all the story.
No, but why? So why do you say that he taught you the best life lesson?
Because it was kind of not that he didn't believe the doctor, but it was like, I'm gonna do my best to live. And I'm not taking no to for an answer right now. I'm not saying, okay, cool, I have a month and I'm just gonna sit at home and and wait for death to come. But he was like, let's do something about this.
So what else so with clinical trials, what else did he try that you saw that you were like, oh wow, my dad's.
So that was always the same clinical trial that kept on being better, and he was always admitted to the next step. And then the cool thing was, so when he had like the very first treatment, wasn't clinical trial, so it was like regular treatment, chemo and some other shit. He was terrible. Like it was miserable. Side effects. That like he had gained like 30 years of age, like in a day. Like that was terrible. That was tough for us also to see him like that. And then with the clinical trial, the cool thing is side effects were very minimum. So he bounced back really fast. He even started working again just as a consultant because he couldn't. He was also an economic teacher in a university. So he stopped that, but like little jobs here and there he would do. And it was just like, it was to me a cool life lesson because I knew, and he knew also that those treatments were not, was the word, curing him.
Mm-hmm.
And that was really clear. Like, so the doctors were like, this treatment, it's kind of like it keeps you alive until it doesn't, but it doesn't cure you. And so, but he was always positive. The most positive person I had in my life. Like it, yeah.
Were there any conversations during those 7 years that really stand out that maybe impacted your life?
He always told me I could do anything I wanted if I put my head to it.
Mm-hmm.
So that was cool because, you know, but at that time you don't really believe it, and you're a kid. I mean, you're a kid. Like I was still a teenager.
Mm-hmm.
I was like, yeah, sure, but I think that he meant it. Now I would understand that. I would understand that better, because I think that he meant it really as an adult with his life experience. And if you put your head to something, you can achieve it. And yeah, you always believed. So I have a brother. He always believed in both of us really, really much. And so that was, no, I think it was the most important thing. I think we had like a few conversations here and there, but it was tough for me when I was a kid to really open up. I feel like I would be better now because at that time I was still like very shy with my feelings, really hard to say. It was really tough to say hard things. Mm-hmm. And so I think that it was that thing where we both knew, but we didn't say it, you know? So that's also a life lesson because now I know that with my kids, I won't be shy with that. Like it's important to have those feelings really shared. So yeah, I guess that's it.
No, I could see it. My daughter's 14 and I'm an open book with her, you know?
Yeah.
And I tell her that Dad's not perfect by any means, but you know, I try my hardest. I show love. Yeah. I try to be humble. Mm-hmm. Like I try to teach her the most important things, and then I show her examples. Like, hey, this is where I screwed up right here.
Yeah.
So pay attention and don't do this. I don't know whether or not she listens, but it's just like you. It's just like you, where you plant those seeds, and then you see, like in the future. All right, well, let's see what comes from this. What?
And that's what I'm telling you. She does. She pays attention. She just doesn't know it yet. Yeah. Because we had a lot of lessons that my dad taught me. I didn't realize there were lessons at that time. And when I say lessons, it could be just conversations or it could be just like, but now looking back, I'm like, shit, like, yeah, this was, I wish it was still here so I could like thank him for that, you know? Yeah.
Well, I'm sure he hears you.
Yeah, I hope so.
Yeah. Well, that's so awesome. Well, I wish you nothing but the best of luck in Colorado.
Cool. Thank you. You should come visit.
Yeah, I will, for sure. Thank you for joining me here.
Thank you. It was awesome.
Yeah, it was completely unexpected. Can you tell people where to find you? Because I know you're going to be in Colorado. You're going to be a little far, but as a health coach, you could definitely still do this via telehealth or via online,
do everything
FaceTime.
Online, yeah.
So where can people find you?
So my Instagram is at Paudeval, which is Paudeval. I don't have a website yet. It's in construction. So like as soon as I have the website, it would be advertised on Instagram. I have a link tree on Instagram where they can schedule a call and everything. So I would say Instagram is definitely the place to find me, and then let's start there.
Awesome. And right now she's working at AeroFit Gym. I just want to point that out. Yeah. She's wearing the shirt. So shout out to AeroFit. Shout out to my friend Alejandro Roque, who's also a personal trainer there, for linking us up.
Yeah.
And that's pretty much it. Thank you so much.
All right. Thank you.
There you go. And that was a podcast.
Damn. That was cool.